Today we will discuss about H3N2 virus. Before we start, first subscribe this channel by clicking below on beautiful logo. Understanding H3N2 virus. We'll discuss its causes, symptoms, precautions, and treatment. H3N2 is a subtype of the influenza A virus that is known to cause significant seasonal flu outbreaks in humans. It is an RNA virus, which means that it mutates rapidly, leading to new strains of the virus each year. The H3N2 virus is also known as Hong Kong flu, and was first identified in Hong Kong in 1968. It gets its name from the two proteins found on the surface of the virus, hemoglobinopathies H and neuraminidase N. The H3N2 virus is one of the most common types of influenza viruses that cause seasonal flu in humans. The H3N2 virus has evolved over time and can infect both humans and animals, including birds and pigs. The H3N2 virus can cause severe illness, particularly in elderly people, young children, and those with weakened immune systems. It can lead to complications such as pneumonia, bronchitis, sinus infections, and ear infections. In severe cases, hospitalization may be required. The H3N2 virus is particularly concerning because it can mutate rapidly, leading to new strains of the virus each year. This makes it difficult to develop effective vaccines and treatments. Annual flu vaccination is recommended to prevent H3N2 and other strains of influenza. Mode of spread. H3N2 is primarily spread through respiratory droplets that are produced when an infected person coughs, sneezes, or talks. These droplets can travel up to 6 feet and can land on the mouths or noses of people nearby, or they can be inhaled into the lungs. It can also spread by touching surfaces contaminated with the virus and then touching the mouth, nose, or eyes. H3N2 can also be spread through contact with an infected person's bodily fluids, such as saliva or mucus. Signs and symptoms. The symptoms of H3N2 virus infection are similar to other types of influenza viruses and may include fever, chills, cough, sore throat, runny or stuffy nose, body aches, headache, fatigue, vomiting and diarrhea, more common in children. These symptoms can range from mild to severe and may last for several days to a week or more. In some cases, H3N2 can cause complications such as pneumonia, which can be severe and even life-threatening, particularly in young children, older adults, and people with weakened immune systems. Risk factors. Certain groups of people are at high risk of developing complications from H3N2 and other influenza viruses. These include children under 5 years old, adults over 65 years old, pregnant women, people with chronic medical conditions such as asthma, diabetes, heart disease, or weakened immune systems. Prevention. The best way to prevent H3N2 and other strains of influenza is to get vaccinated annually. The flu vaccine is typically available in the fall and is recommended for everyone over 6 months of age, particularly those in high-risk groups. Precautions. To prevent the spread of H3N2 virus, it is recommended to practice good hygiene habits, such as washing hands frequently with soap and water for at least 20 seconds, or using an alcohol-based hand sanitizer, covering the mouth and nose when coughing or sneezing with a tissue or elbow, avoiding close contact with sick people, staying home if feeling unwell. Treatment. Most people with H3N2 and other influenza viruses recover on their own with rest, fluids, and over-the-counter medications for symptom relief. However, in some cases, antiviral medications may be prescribed to reduce the severity and duration of symptoms, particularly in people at high risk of complications. These medications work best when taken within 48 hours of the onset of symptoms. Seek medical attention immediately, avoid self-medication. Thank you, and subscribe and like the channel now.